Today we're going to just talk a little bit about being active, evaluating movement. I am Dr. Foss. As you said, I have a ridiculous amount of letters after my name, multiple degrees, and mostly rehabilitation. I'm a chiropractic doctor, that's how I practice. I do also have my MD degree. However, I practice as a chiro down here. I don't do medical, I'm not a medical doctor down here. So my specialty, as I said, is working with athletes. So I have 2 diplomates, postdoctoral degrees in rehab and as a sports physician. And so what we bring to the community is really looking at movement. And so I like to look at people in motion, which is a little bit different and unique to a typical chiropractor or physical therapist. And we're going to have some fun with each other today. We're going to look at each other's bodies. We're going to watch each other move. We're going to make you guys honorary doctors for the day and start looking at how I obsess over people all day and how you might open your mind and look at people a little different way. Okay? So this is what the front of the office looks like, and these are the services that we do there. We have lots of different types of treatments: acupuncture, sports care, lumbar decompression. We do have some decompression folders here, what that's about for those people with back pain, with some research behind it, what it looks like. So if you guys want to help yourself to that. We also have many different types of, I'm going to hand these out, many different types of services that we offer, but really, taking in mind, looking at the movement body and keeping you moving, so you know that total hips and total knees are the #1 elective surgery performed globally right now. Those are the 2 things that are performed globally. So if we really can keep people a little bit healthier, then we can prevent some of these injuries. I just published a book on the hip. It's a medical textbook that took me 4 years to write. It just got published in November, so that's just teaching doctors how to evaluate the hip. It's all on just the hip. How to evaluate the hip, how do we look at the hip, how do we rehab the hip and bring somebody back to activity again. So what I typically see sometimes is people are released from PT and they're still limping, or they're still, they're not completely back in a biomechanical way. And that's how we're going to learn to look at each other today. We're going to kind of open our lens and evaluate movement. So this is the inside of the office. I do a lot of video analysis. So the cameras come out, they surround the treadmill or the other area, and we have you moving. We're taking a camera out, we make an avatar out of you. We check the range of motion at every joint. We see where your fault patterns are. Now, I talk a lot about fault patterns. Fault patterns to me is the why of an injury. So we all have injuries, right? We have back pain, we have spinal stenosis. You're going to PT for what?
Shoulder.
Shoulder. No complaints? Or is there a list?
I've had a few, but I'm okay.
You can pay it for you. All right, you pass.
I had a really bad acetabular fracture a few years back.
Oh my gosh! Wow.
Yeah.
Ooh,
So I happened to be in the room when it happened, so that
oh
was
my
fine.
gosh! Wow. Holy smoke! That's a big one.
I got back here and got taken care of.
Yeah, good for you.
Yeah.
But when we talk about injury, of all of you that have injury, there's the injury and there's the why of the injury. And when I travel around the globe and I teach doctors, my big thing is trying to teach them, let's just not myopically focus at your injury. Let's see where it's coming from. Why is it there? Why is your back pain when you play pickleball? Is it because your shoes are the wrong shoes for you? Is there something else? There's always a why. And so in medicine, we get in the habit of treating the what and not taking the patient the one step further for the true fix. Why is your shoulder sore? Your shoulder could be sore because your glute isn't working, which we're going to look at today. So is there another reason, something else you can work on to help get you really better? Okay, wrapped up in a nice package. So when I look at athletes, I try to prevent injury. So if I want somebody to go to the Olympics, since I work with Olympic sports, I want to not wait for them to get injured to treat it. So we're always looking at movement and action so that we can learn to understand. So here's something important that we need to consider, right? If we're going to really evaluate motion, whether you're playing pickleball or walking around the neighborhood or whatever you're doing, we've got to evaluate 3 stages of gait that we call, right? This first stage here, when your heel comes down, it's when your body accepts weight, all right? When your body is accepting weight, certain muscles have to be active. Am I moving too much for you?
I know, I'm trying to keep.
I'm so sorry. Certain muscles have to be active And they're very specific. So as we're watching somebody run, as their heel comes down, I'm looking for a certain group of muscles to activate. When they don't activate at the right time, we have fault patterns, which means it opens you up to injury or destabilizes your back, which you're gonna see a lot about that today. Then this is the first stage, I look at the heel strike. Then the most important phase that we're looking at motion is this first slide here. That's when all your body weight is over your body, right? Everything is over. That's when we get the greatest fault patterns. So in this stage right here, what's happening? Is your knee collapsing? Is your hip collapsing? Are you throwing your shoulder over? So when we look at movement, we can really evaluate how to get somebody truly there. And then this phase right here, when you toe off, is when you are able to grab big muscle groups. Yeah, that's okay. Grab big muscle groups, all right? So are you able to grab your glutes? Are your glutes turned on? We're gonna look at each other today and see if your glutes are turned on or turned off. If your glutes are not turned on, you cannot have a healthy back. It's impossible. Because when your glutes are tight, it shrink wraps your back and is the first level of stabilization. Same thing with feet, so we're gonna look at feet today too. Okay, so in the office, I don't know where my letters are, but in the office we have a golf simulator. So those people that are playing golf, or we use it for pickleball or tennis, we have you bring your paddle or your golf club in. We actually have some extra golf clubs there. We turn on the simulator, we have you hit and move into that or swing your paddle ball. I wanna see what's happening during motion. All right, so for like you come in with your pickleball paddle, and I wanna see if you're always sore after pickleball, I wanna see you doing that, because why is it getting tight? You know, so if you didn't play pickleball, your back probably not get too sore, right? So there's something that's happening. So to get to the bottom of that, we really need to see you moving. So we have this movement lab in there that's super fun and a little unique. So we're gonna get into this conversation about these kinetic chains. So this is a catchy term today in medicine, particularly in rehab medicine or those of us that are looking at movement. And we need to see during certain phases of movement, certain muscles that are highlighted by those different colors turning on. So those of you that want to be active, whether you're going for a walk down the street or you're playing a sport, I need to know which phase are you in during that sport. So I'm going to pick on you, so because we talked about it. For pickleball, I want to know, are you able to go through all these phases and activate that? Okay. So we have to understand and really appreciate these kinetic chains. So that's how we evaluate. For those of you, we're going to look at each other's stand today. We're going to do a postural analysis on each other. We're going to evaluate your stance, because it all begins here, right? Your ankles, your hips, and your neck. If those three things are not in a line, nothing else can work. So it's kind of like, you know, if your tires are not lined up, they wear funny, right? It's the same thing with your body. If your body's not lined up, your muscles are at a biomechanical disadvantage. They can't work to help you. And so this is why as a chiropractor, I'm always focused on posture. But in healthcare, we really need to focus on posture. Also, we know from our research that if you have poor posture, you can have increased respiratory distress, you have more fatigue, you can have cardiovascular discrepancies. So just doing this kind of collapses your lung fields, doesn't allow you to get enough oxygen in, so you're more fatigued during the day. So working on postural exercises are very important, which I'm going to show you. Okay, so what I'd like to do is I'd like for you guys to pair up in couples and stand up. One person's going to be the honorary doctor and one's going to be the patient. So let's stand up today. All right, introduce who's the doctor and who's the patient first. You're both going to get a chance to be doctors.
You're going to be my
I'm
partner?
your doctor. I'm Dr. Foss. It's nice to meet you. Okay.
What's your name?
Okay.
My name's Art.
Art and Bob, how are you?
Okay. All right, great. You know, in medicine, in schools, I travel around to all the chiropractic schools in the country. Students are not allowed to touch people unless they introduce themselves and ask it's okay that they touch them. So it's a new thing with this generation. You're at a doctor's office, how am I gonna look at you touching you, right? But we have to ask.
We touch hands, we were.
Yeah, it's so funny.
When I was in some places.
Okay, so we're gonna start looking at your patient doctors like we're looking at this gentleman. So you're gonna have, I'm gonna stand here, you're gonna be the doctor, okay? You're the doctor. So we're gonna stand with our side facing towards the doctor. Okay, all right, docs, you looking at your patient? You're
You're
gonna
the
stare,
doctor.
you're the doctor,
I'm
right?
the doctor.
You're the doctor, you're
Okay.
gonna stare him, okay.
Yeah.
All right, docs, I want you to first look at, is your patient's ear, now, I don't want you to try to pretend to have good posture. First, patients, let's have you march in place. All right, we're gonna do 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now relax. Is your patient's ear lined up with their shoulder, the center of their shoulder?
Well, there's a little bit forward, but.
Forward. Mhm.
But
So every
compared to me,
inch,
not much at all.
correct, every inch forward your neck is 10 pounds additional pressure on the upper back.
You're weighing.
10 pounds for every inch forward.
Yeah,
So
but
that
it's
starts
not
setting the
terrible.
kinetic
It's pretty
chain.
good,
Yes.
but it's a little.
Yeah.
And every inch
At about
forward, the more you roll onto the
70
insides of
degree
your feet.
angle.
Okay?
Should be like
Makes
this.
sense.
Every inch forward, you extend your low back, so you have a low back problem. Okay? So every inch
Shoulders
forward, you
here,
start collapsing
like
your
this
hip.
much distance between
All
the
right,
shoulder
so
and
the ear and the shoulder is lined up. Is the shoulder and the hip and the ear lined up?
shoulder.
Shoulder,
I think shoulder depth,
ear,
pretty good.
shoulder, center of hip. What do you think, Doc?
Looking good.
Look, thank God, thank
Yeah.
God.
You better
So
thanks.
now we got ear, shoulder, center of hip, and I want you to look at the ankle bone on the outside. Is that lined up? All three should be lined
With the
up.
hip,
Yep,
okay.
1, 2, 3, 4. We should have a nice alignment.
Yes, everything.
We
but
good?
the ear.
All right, let's switch doctor and
The ear
patient.
was in. The ear, no, ear was kind of forward. The head's.
All right, let's march in place, new patients. Just the patients, the doctors can rest. Okay,
You the doctor?
You're the doctor now.
Oh.
We're switching roles.
okay, all right, that's okay. All right, stop, stand normal. All right, doctors, is the ear, and that's just the whole of the ear,
I know
right?
mine's
The whole
not.
of the ear,
I've already had
lined up
X-rays
with the center of the
before.
shoulder. She's pretty far forward. She's at least 2 inches forward. Okay?
Yikes.
Which means that I can stand behind her, and know for
Really?
sure she's gonna be tight up here, right?
Yes.
It's
Yeah.
about an inch. Okay.
Now is her whole of the ear, I call that the
Okay, there we go,
EOP,
like this.
is that lined up, center of
Well,
shoulder and the
yeah.
center of her hip? The center
With
of the
this.
hip.
Not natural.
And is that lined up, the center of the ear, center of the shoulder, center of the hip with the outside of her ankle? So she's got a forward head and she's got a flexed body. So she's here, right? So let's get a look at your patient now.
Pardon?
You're like that too. You're like.
Okay, now doctors, we're gonna look at the back of your patient. So get your, face your back to your doctor now.
Anyway, yeah.
Face your back to your doctor now. And we're gonna have a little fun.
Ah,
All right? So doctors, I want you to look at, getting a little intimate here, your patient's glute muscles. Is there one muscle that's not as developed as the other? Is the right side not as developed as the left? I know we're getting intimate. I had you introduce each
Pass
other.
down, Art.
I had you introduce each other.
What about this touchy thing?
Is there one
You
that's
have to
not?
ask first.
We literally have to touch
Just
it.
be afraid,
You gotta
say
let
yes.
it go. One side, so see the difference? You can just relax your arms.
Pull your pants forward, Art.
So see how she
Which
pulls
one's
this
this?
Pull it
muscle
forward. Like,
different than this
let me
side?
do this.
Did
You
you
do
do
this.
this one more?
On the
Yeah.
front, so I can
See
see.
that?
There you go.
Okay.
See,
Because
she-
I have
Get
a
your wallet,
scoliosis.
let it
It's
walk
kind of like this, yeah, she's got
Stuff in my
scoliosis,
defect
okay?
all the
You
time.
see that,
Yeah.
he's, got cheating.
He's getting it.
All right, so this more developed
Yeah.
than this side,
Yeah.
right?
Mhm.
Okay,
So the
all
right
right,
side is where I have piriformis problems.
Because I'm seeing.
because you got the wallet. Okay, now,
I do too.
I want you to look
Yeah.
at the back of your patient. So this one's less developed than this one. And I want you to tell me which shoulder is higher or lower. There's always a lower shoulder.
That's higher. Can you feel it, Art?
That's
So
the
this
higher
is,
one, right?
which is your
Oh,
painful
okay.
shoulder?
Is that the higher
Well,
one?
this is
That's
my,
the higher one, yeah.
my painful
Hip.
hip.
There's a reason for that.
Yeah,
There's no
reason
to your
There's a
shoulder?
reason for all of us.
No.
And that's what my x-ray showed, so, yeah.
So which shoulder is your painful shoulder?
Oh, I have 4 rotator cuffs that are completely
Oh.
torn and retracted.
Boy.
Okay.
So I'm trying
That's
to
what, you had knees done.
anterior replacement.
Yeah.
So you see how she's
Recently or
so
before?
crooked here?
10 years
Right?
ago,
So crooked.
both
So
of
that
them at
throws
the same
off
time.
How
Here,
this,
Bradenton?
how this works.
No,
too.
up north.
So let's look at the feet of your patient now. Are they standing with what we call talus neutral, or are they rolled in, or are they rolled out on their feet?
My Brooks shoes compensate for
Just the
my.
feet or the ankles, just the feet.
So you'll look at the, well, the ankle and the foot kind of go hand in hand, but are they in or are they out?
Just the feet.
Right.
So which shoulder is your painful shoulder?
Is that the higher one, right?
See, he's rolled in more on the left than the right,
Yes, yeah.
right? Which is really interesting, for his glute, because we always usually see how this guy's more developed than this one.
Okay.
How he's got the difference, this guy's more developed. than
Yes,
this one.
right.
It is.
Right, and so we always see that in
Very,
correlation
very,
with the
I'm
foot position.
observant.
Okay, all right, great. Now let's switch doctor-patient.
Okay.
And let's look at the back of your, so you got a higher shoulder on this side, you got a
Okay.
weaker scapular side on this side, you got more tone on this
Like me
side,
on this one.
and you're
You feel
twisted
it?
like this.
You know, I know
I
that.
mean, you-
Okay,
What
look
about
at me
my
now.
stance?
You-
I'm not aware.
Oh,
I
your
mean,
stance is actually more
mentally
rolled
aware of
in
it.
on this
Yeah, I
side
mean,
than this
yeah.
side.
I can't
Okay.
remember
So
what my.
hold it.
Yeah,
Okay.
this
All
is
right, you wanna
already-
look at me?
Yeah, okay.
All right, so you're gonna look for the low shoulder, which shoulder is lower than the other side,
This one?
yeah? And you're gonna look for which glute is developed, not the same as the other side,
This one
bigger.
looks like it's more developed than this.
Maybe this
This
side
one,
is more
yes.
developed,
Okay,
but
yeah.
you look pretty good.
All right, thanks. And then feet, look at the feet, are the feet rolled in or rolled down?
Rotator cuff here.
Okay.
It went pretty straight.
Pretty good, yeah.
Yeah,
I
sure.
see your feet are straight. Okay,
But it would take
wonderful.
3 months
You guys
to
good?
recover.
I'm gonna
Yeah.
look at you while you're standing.
Okay.
You're
That's a
forward,
lot.
you
Now the
have-
pain's
your
gone.
back looks like this to me.
Maybe you're not using it as much as you were.
And
That felt
then
good, actually.
This foot rolls in more.
Do you normally sit,
Okay.
stand with your feet going
You're all
out a
set.
little bit?
Okay, guys, you can sit back down.
So you, can I just ask a question or make a comment? You said something
Your feet go
about,
out just a little bit. So I
if
think
we
that's
move forward a little bit, it's like
compensating
extra 10 pounds, then you mentioned something about the hips.
Yeah, I'm gonna
Right.
use you as my example.
Okay, because I play something like,
for, do you have a spinal stenosis?
Mhm.
where do you call
Okay.
it?
Okay, you guys ready? You guys can sit.
Okay.
So, what did you determine?
Your left shoulder was
Prognosis.
lower than your
Lower.
right, yeah.
Okay.
And I couldn't tell about the glutes because there was a wallet in there.
Okay, ah, cheating.
But he
Okay, we're
took it
gonna
out.
bring you up. And I just wanna teach you how I look at somebody. I'm gonna move this out of the way. If you could stand right here facing away from everybody. All right, we're gonna let you all take a gander at him. And just come right here away from that. So, you know, he has back pain when he plays pickleball. Is that okay that I say that to everybody? Okay,
Of course,
all right.
yes.
So I always look at, he only is sore when he does that. So is there something I can do to re-get his body to accept that weight and movement better without tightening up so that he can, let's get him to play pickleball better than he is right now. But if you can see how he's higher on this side than this side? Can you guys see that little bit of, you guys see that? I stare at bodies all day, so some people are like, really, you're seeing that?
Higher on the right?
Right, so this guy's higher, you see that guy's higher, sticks out more than that side?
Ooh, very
Can you
stiff.
see how this is a little more active than this side? I'll stand back so you guys can see that, you guys can see. Good, right, so can you see, to me, he looks like this, I'm gonna make him do more, all right? To me, he looks like this, you're gonna face that way. We're just gonna rip your body apart for a second if you don't mind. To me, he looks like this is going this way and this is going this way, Blanc. Now just stand normal. Now do you guys see it? He's kinda got this double Z. Yeah? You guys are focused? You can see how this upper body's going this way,
Yeah,
lower body's going that way,
yeah.
right? So typically, that's a pattern that we see when somebody has a herniated disc in the back. We usually see that because the body is kind of like a wedge in a tree when you chop a tree down and they start listing away. We tend to see that. But you can also see how he kind of flares out here a little bit. See his legs kind of come apart down there?
Right, and then he slams.
Yeah, yeah, and then he rolls to the insides of his foot and the left foot is more than the right foot. Can you see that?
Yes.
So he's not accepting weight in a good way, right? So he's already at a biomechanical disadvantage. Your shoes and your footwear, number one for protection for everything, for everything. So for him, nothing can be perfect. I would first start with getting him in a good shoe and seeing if he would need an orthotic. And then looking at, trying to straighten this guy out here, okay? You guys all see what I'm
Can
saying?
that lead to knee problems as a result?
The knee is the slave of the lower extremity. The knee does only what the hip and the foot tell it to do. So if you have good footwear, if you have bad footwear, the knee's gonna be sore. If you're doing something wonky with your hip, the knee can be sore. The knee kind of does whatever, it's like, all right, I'm stuck doing whatever everybody else wants. So whenever anything is bad here or here, this is a potential to be bad. Okay, thank you for us.
What would you say-
I do wear a lifted shoe. 'cause
You do?
My right
Oh,
foot,
that's
right leg
interesting.
and shoulder.
Yeah, you're only a smidgen off, but you're more sideways, which is interesting. So for you, I'm gonna have to show you an exercise to try to get that realigned again.
Okay, good.
Okay?
good.
Yeah.
A lecture. Tell
Hi,
me.
how are you?
Good.
You're welcome to come and sit if you
No, I
want.
just have to, I come in and set up for poker later. I didn't know how long it's
Okay.
going to last.
We won't
Poker
be,
guy.
we're gonna be
Oh.
half an hour maybe.
No, don't sweat it all.
Okay.
Good luck.
Maybe
All right.
12:15.
No, that's fine.
Okay.
Okay, so if we talk about squatting or watching people moving, I like to put them through a motion and see. Now, when we do a squat, which some of you probably can't do, it's the greatest assessment of every joint moving at the same time. So I really can get an idea of ankle mobility, hip mobility, low back strength, shoulder mobility, and neck position. Yes? Any question?
No.
Okay, all right, good. So we look at these 3 points of interest. So for you, in the future, I want you to think about your posture. And that's what this first part of this lesson is, how important that is for metabolic health, but also physical health, an injury, getting that ear up over the shoulder. If you have a difficulty time knowing what straight is, because you have an extreme forward head, it's gonna take you a while to improve that. But I tell everybody, stand up against a wall and push your chin straight back. You should be able to have the back of your head touch the wall. Okay, if you can't get your head back there, put a towel and just slowly start pushing over time and make the towel skinnier and skinnier until you can stand nice and straight. Okay, that's called Z-axis traction. Okay, as we talked about feet, and I want to encourage you to really make sure you always have good footwear, not just anything off the shelf. We really get into these patterns of using our feet very, very differently. And so you can imagine, this is an elite gymnast, male gymnast, how he's landing on this heel. See how developed that heel is
Yes.
versus this heel?
Yeah.
See that? And you see how developed this forefoot is versus this one right here?
Huge.
So he's got a problem on his right ankle, but we have to look at where did it come from, right? Because this is over a long period of time. This formation takes a long time to happen. Now, this calcaneus right here, that's that bone in your foot, this fat pad that everybody has at the bottom of their foot reacts over time to the stress you give it. So remember we said when you put your heel down, right, you strike your heel, it accepts body weight. But if you're not striking on this side and you're putting all your weight on this side, over time this fat pad gets bigger and bigger. And so I tell patients, and I teach doctors all the time, calluses don't lie. Look at your patient callus pattern, because it tells me how they're using the rest of their body. So for him, even though he had a right Achilles tendon problem, we were able to figure out it really is because he's got a left knee problem. Okay, that's the pattern. It's kind of complicated, but I'll explain it. Whenever we see heel weight, you're deloading the front of your knee. So that's how we figured that out. Okay, you're gonna cooperate with me? No? So I'll just go this way. Okay, so again, talking about transferring force from your foot up with all the activities you do, whether you're just walking on the sidewalk, are you wearing a good shoe? So all of you have sneakers on. I want you to take your shoes off for me, if you could. And let's put them right up on your table. Let's see if your shoes pass the snuff test.
The snip test?
Snuff. Not the sniff test. We're not gonna do that today.
Probably not.
Probably not today. All right. So what I'd like you to do first, I'm gonna take my shoes off so I can kind of join you guys and show you what I mean, is you're gonna take your shoes and put them right up on your table in front of you, just like this. Okay, good. And I want you to line those heels up nice and straight. We're first gonna notice, is one heel more worn than the other from the back? So look at the back of yours. Is one heel worn different? A lot of people have a scuff mark or a heel worn pattern on one side versus not. How do yours look?
No.
Yours look
These are pretty
okay.
new.
Very good. New shoes are tough to, but you have inserts in there, which is wonderful. Good for you.
Had about 2
Okay,
months.
now what we're gonna do is you're gonna turn your shoes over like this, okay? And I want you to really examine the bottom of your shoes, and I want you to notice, is anything worn more on one side or one area versus the other? So look at how hard you're hitting your heels. See how that's worn there?
And this is worn a little bit more.
Yeah, you see that? And then also, so you're hitting really hard on your heels when you're walking. So we've got to go back and look at you move. Anybody else have a weird wear pattern on theirs?
The ball of my foot on my left is always, the insert always wears out before.
Oh,
everything
interesting.
else. Because I went to a podiatrist once, and they said that the ball of my feet is like walking on high heels all the time.
Yeah,
So-
for sure, so you can see how this is worn more than this side, right? So if you're wearing rubber out, that's a serious, you know, if you're hitting the
This
ball.
here area here, this is on
Yes,
the
that's really interesting.
scuffing or something.
Yeah, because usually at that phase, you should be on this side, right? But you're also hitting kind of hard on your heels.
Yeah.
But you're staying on the outsides of your foot on this one, not so much on this one you roll, which is really that's an interesting pattern. How about you? I'm gonna steal your shoes. Oh, all right, you need new sneakers. Today. So it's kind of like there's no tread left on the tires, you know, of your car, that's for sneakers. You need new sneakers today, okay?
Yep.
Sorry.
But these are old sneakers, but I
Oh,
wore
good.
today.
I love old sneakers, because then you
So
can tell
look at that thing on the front toe there.
Mitch, how about that?
That's
I
my
couldn't
left
figure out
foot.
which one
Yeah.
where
And then
for
my-
sure.
So you're
Right.
dragging that front toe.
This is,
So, you know what? We would have to, because that is a sign of somebody that has a pinched nerve in their back, because they drag their toe, hold a toe, a foot drum. So we'd have to see if that's it, or is it something that you do maybe playing pickleball? So we'd have to evaluate that further. So you hit hard here, you go
Yeah.
straight here, but look at how it's not symmetrical. Look at
Right,
this
right,
one.
right.
Versus this one and then
Right,
that. So
yeah.
we can really take that pattern and start figuring out, why do I do that? Like, why is my toe worn out? And then watch you move. So we start putting it all together
I
that way.
think it's the first time I turned my shoe over.
I know, but it's
To
a
even
big
look at it.
revelation for you, right? It's a big revelation once you
Yeah.
see it. The other thing is I want you to look at the insides of your shoes now, like this. So put them apart with the inside of the shoe, not the outside, facing towards you. Inside facing towards you, just like this, okay? And I want you to look, does anybody have this area worn out? This area up here, does anybody have this area, kind of scuff marks on it or
So
worn
inside
out?
and one outside of the other one? Or what?
Both inside, the insides of your shoe. So let's see if you have that. No, you don't, you're good. All right, how are you doing?
I think I do.
You're pretty good, all right. You passed the test. How about you?
Not yet, they're too new.
They're
But-
too new,
But my last
okay.
pair of Brooks wore out right back here at the back of the
They,
heel.
the heel,
Yeah, like literally.
okay. I thought you were gonna fail this, but you did it. Okay. All right.
Mine are on the inside.
All right, yours are pretty good, but this is pretty high, so it's probably, all right, so pretty good, wonderful. All right, the other thing I want to teach you all, do you see that you have an extra hole up here?
Mhm.
You're supposed to be using that if you have that hole. When you step down, the shoe is only as good as this heel counter. So I want you to hold the back of your shoe, one shoe like this, and I want you to squeeze the heel. Pinch it between your hand and squeeze the heel like this. If you can collapse and it smushes under your fingers, it's not a good shoe for you. So they're for you, right? Because the heel controls the first phase of gait. And if your heel is wobbly, everything else is going to be out of sync.
Oh, geez.
So whenever you try a pair of shoes on, the first thing you do is pick it up, pinch the back, and see that this is nice and sturdy. Okay? Everybody have a good sturdy heel counter? Now the other thing that you want to use is that extra hold. So not only do we want the heel to be steady, I want to hold that here when you're walking. Okay? So we want to think about taking your laces here and making an extra, put it through the extra loop on the same side. So everybody do this together if you have an extra loop. So you're gonna do just like this, right? It goes through the same side, like this. You with me?
Oh, the same side.
Same side.
Okay.
Mhm. Make a big loop, and then you're gonna leave that loop like that, and do the same thing on the other side. All right? And pull that right out. So you'll have two loops, one loop on each side of your shoe, just like this. Good. Now you're gonna take the opposite side, you're gonna take the opposite side and put it through the loop. This is called a runner's loop.
I was gonna say, I used to do that when I ran.
Yes,
Mhm.
because it allows it to keep your foot nice and steady,
That's cool.
and that's the new way to lace your shoe, okay?
For any
Because
shoe, or just like my
if you-
pickleball shoes?
If
as
you're
well?
doing a lot of walking or any activity,
Okay.
okay?
Yeah.
Because you really want to make sure you're holding that ankle steady. Okay? That's really important. I'm gonna put one shoe back on, let you guys do that, and then we'll talk about the front of your shoe. Good, okay. Now if we look at the top of your shoe, I'll let you guys finish, take your time, you guys good?
I can wait.
We're gonna look at the top of your shoe, all right? And I want you to notice, where's it worn? What's your crease pattern? You have a large crease here that you're bending? Is it pushed out along the outside of your foot or the inside? What does that look like? What does the top of your shoe look like? It's a large crease pattern here, which is okay. And certainly some breakdown here. So do you wear a wide shoe or a normal width shoe?
Probably normal width, but
Normal width. Yeah, so you could even go for a wider shoe for you, just to have less stress on your forefoot,
yeah.
particularly this side, and that side too. Not as much though as this one, right? This was just a little bit more breakdown to it.
But I have to say, I'm one of those just.
I'm the opposite, I have a narrow
Don't know the
foot.
better between
So
a
for you,
better
like,
shoe or not.
a Nike brand is a nice narrow brand shoe that holds you steady. So for you, you really want to keep control of your foot so that everything else can be good with all the activities that you do. So footwear is huge. All right, you're going to keep your shoes off while you do have shoes off, and you're going to stand for them. All right, I'm going to jump ahead here, and we're going to do a balance test while we have shoes off. You guys ready for some fun?
Yeah.
All right, so, let me just finish tying my shoe if that's okay. I'm going to time you 1 minute. You're gonna balance on one foot for me. Okay, now,
10 seconds.
if at any time you feel unsteady, unsafe, you sit right down, okay? However, if at any time you do a check, a bounce check, or any of these guys, or touch your foot down, you have to sit, all right? So it's gonna be a stand
10 seconds.
on your non-dominant side. You have to help us, stand on your
Give me
non-dominant
another
side.
curve.
And then, you don't have to do it yet, I'll wait till I set a timer up.
What term is it not your dominant side?
The side you write on.
Oh, okay.
Okay, so the opposite side you write on, so if you're right-handed, you're gonna stand on your left foot. You're gonna stand with your foot off the ground, all right? We usually ask for it to be as high as the other foot, but we'll be nice today, we'll just say off the ground, okay? If you have one of these, or you tap down and you gotta touch the table, you must sit. I'm gonna time 1 minute, all right? What you've gotta do is at the time, remember the time most closest to the time you sat down. So I'll give you a time, I'll time off every 10 seconds, okay? And just remember the time most closely to the time that I call out, that you had to sit. Okay, you gonna join us?
I already failed.
Okay. Okay, no problem. Get that. All right, you ready?
I'm out.
Ready? Non-dominant side, just pick up your foot. Now remember, if you feel unsafe, just step down and sit. Ready? Go. Up your foot. Good. 5. Okay. 10.
Yeah.
15. Okay. All right, guys.
Here's the lightweights in here.
Balance
This off my
is
bad knee.
absolutely everything.
Yeah.
Okay, there's a new research that just came out in New England Journal of Medicine that says if you can't balance for 10 seconds on one foot, your chance of survival in 10 years is down by 50% for dying from any cause. That's a big, scary number to me. So if there's one thing that everybody has to do is learn how to balance and start practicing balance at home. When you're brushing your teeth, even if your fingertips are on the side, just do little balance checks throughout the day. It is amazing. You're gonna stand up again. I promise I won't test you, but we've gotta try something else. All right, here's our first test. How we check for balance and how to teach you new balance is we check some muscles that are inside your feet, okay? There are 19 muscles that help control your feet and coordinate balance. Let's see how you guys do. So what I want you to do first is, without doing anything weird with your feet, rolling them out, rolling them in, anything like that, I want you to just keep all your toes on the floor except for your first toe and lift your first toe up. Just your first toe without the other toes. The other toes have to stay down on the floor. So all the other toes have to stay down. Just your big toe comes up. Just your big toe. All your other toes have to stay on the floor. See how you're lifting them all up?
Oh,
Just your big toe.
I don't know that that can happen.
Right, just your big toe, without rolling your feet this way or that way.
Wow.
You're competitive, I can tell.
Dang right.
Just your big toe, all your other toes have to stay down. All your other toes have to stay down. A lot of you are talking to your feet, okay. That's the first fail, if you can't do that, for
I can't-
balance. Your
I can't
balance is
do it
already
at all.
sunk if you can't do that. Now, rest your feet down. Now we're gonna do the same thing, but big toe stays on the ground, no rolling your foot in or out, raise toes 2 through 5.
Ain't no way.
Okay, so huge for helping you. You guys will notice a huge change in how you change direction on the court if you work on foot strength. Okay, lastly,
Wow.
your foot should be able to stay flat on the floor. Don't raise your toes up, and you should be able to create a space between each toe on the floor. As if someone's gonna hold your hand, but your toes should be spread apart. All right, I'm gonna say all of you get big fat F for today. Okay,
Sure.
all right, so that becomes your exercise. That's what I want you to do twice a day. Raise your big toe up, hold it for 5 seconds, relax. You can even do this sitting. Raise the other toes up, hold for 5 seconds, relax. Spread your toes, relax. I even tell people you can even do it when you're sitting on the toilet. Like there's any time you can do this exercise. And you'll notice a huge change with changing direction, balance. We all need to stay vertical and safe, right? So balance is a huge one. All right, you guys can sit. I'll let you guys rest. We've had you up.
I woke up with a
Moving.
Charlie horse in my big toe the other day.
Oh.
Yeah, so for you, get those feet strong. You'll see a huge difference in how quick you can change directions.
Wow.
Okay. This is some research I just thought I'd bring up, that if your footwear isn't good, you change the way all the muscles activate. So we have research that proves this now. So when I teach doctors, I show them these graphs and I explain when somebody rolls in and they have a bad shoe and they don't have an insert. I notice a couple of you have inserts in here, which is wonderful. Your low back muscles don't turn on in time. So if you roll in and you have a bad shoe, which is you, this soft shoes, what happens is your low back muscles delay in being able to keep your back up straight.
Wish I'd bought my pickleball shoes, 'cause I don't. these
Yes,
are
I
just
would
like
love to
knock-around
have seen
shoes.
your, yeah, I would love
Yeah.
to see your pickleball shoes.
Yeah.
So, we really look at, when we evaluate patients, we really look at, their ability to move, so this is an example of lumbar decompression. Some people asked about that. I did bring a picture. That's what that looks like in the office. It's kind of like a new age, space age thing. The angle of pull is set exactly for where your complaint is, so it's not like a regular generic traction.
Makes a huge difference in the
yeah.
support of the shoe by just doing that extra lace.
Oh, it's so great.
Yeah.
It's such a difference. That extra lace is huge. So this is what we did earlier. We looked at each other, and we looked at which glute was low tone, which shoulder was low. But if we were to look at your skeleton without all your muscles on it, I, as a chiropractor, want to see about the joints, what's happening with your hip, what's happening with the muscles. So imagine those of you that have a foot structure problem or a low back problem, like for you, if I was just to adjust you and send you out of the office, I wouldn't really be doing you a service, because over time, the muscles on one side become shorter, the muscle fibers become shorter. So by the time you get home, you've already lost that adjustment. So stretching. This is my big banter on making sure we're stretching. It's such an important component for overall health. Someone in here had hip. Is it your hip? This is what your hip looks like, right? This is what I spent the last 4 years of my life obsessing over as I wrote my book on the hip. This is what the joint actually looks like. It's a wonderful joint. There are 23 muscles that control the hip. So it's really important that we think about strengthening around the area when you guys are exercising. This green part here is called the labrum. That's the cartilage that starts to degenerate with degeneration. I thought I would show you an example of different people you might see walking around the neighborhood. And you can kind of become the doctors of the neighborhood and evaluate those of you that have this, what we call a varus knee. The knees are separated, bow-legged is a better term. What we really see though is this comes from a change in the shape of your hip, which is very interesting, which I'll show you on the next couple slides. This is normal, and see how some people have a collapsed knee. But remember I told you the knee is the slave of the lower extremity? This position a lot of times comes from hips. So if we think about, and it's not dark enough to see it, This angle of this hip right here is a valgus hip. This is that person that has their knees collapsed. This is also usually a younger person, but some people grow old looking like this. This varus hip is the one that has the wide bow legs, okay? Now, the really interesting thing about hips is we're born with our hips like this. And as we get older, the hip gradually changes like this. So it slowly turns into like a 7, okay? So the reason why we get so many hip fractures in elderly people is because the shearing force with this as it changes to this, and you get a little osteoporotic, when you bear your weight down, it shears the force right through that. So it's the angle. So we look for the bowing legs, and we worry about that bowed leg person if they're gonna be our broken hip person, okay? So staying active is really the best case scenario for overall health. I thought I'd show you a sneak peek.
Excuse me, Chris, I have a question. So if you got that gun on that number 7 thing, I mean, you can't really correct that at this point.
You don't correct it.
Yeah.
So what we do is make sure you have good bone density, you're staying active, and we put a lift in your shoe to take the pressure off the feet so that you don't have these bowed legs so much. But also puts a lot of stress on the knees. Yeah. So just trying to correct what we have,
Yeah,
right? Because it's a
right.
normal process of aging. This is all the muscles that I teach about when very, very common for people to have gluteal pain that's getting accidentally treated for low back pain. And so when I travel around and teach on the hip, I teach doctors how to differentiate the two, because a lot of times they're misconstrued. This is my father-in-law. He lives up in Parrish. We brought him down as a model for my knee machine. This is a knee traction. So this is actually my mother-in-law. We put her there to make her look like a patient for our website. I'm like, lay on the table. They're really cute. Yeah, so this is a knee traction. So for those people who have osteoarthritis of the knee, torn meniscus, knee traction is something new that's coming out. All right, we're gonna do something fun before we're done today. We're going to do a timed up and go test. You guys familiar with this test? Okay. This is a test that's commonly done to determine your fall risk, and your ability to navigate courses. So mostly fall risk. So we're gonna set up a little course. We're gonna set up 2 courses and do it twice. All right, so what you have to do is you've gotta walk to the chair. I'm gonna set up some chairs for you. All right, I'm just gonna demonstrate. We're gonna make a starting point here. You're gonna walk to the chair. You've gotta turn around. You have to sit in the chair, stand up, and walk back, okay? All right?
Without the use of our
Just one
hands
time?
when we sit.
You can sit and stand however you choose.
Okay.
Okay? So we're gonna set up 2 little courses here, 2 people. So we're gonna form 2 lines right over there. 2 little lines, okay, good. 2 lines of 2 people. And we'll start right at even with the carpet. So you're gonna walk, you're gonna turn. No touching the table if you can't help it. Sit down. If you have to touch the table, fine today, okay? No problem. And get up, okay? No
So
problem.
just one time or multiple times?
And all the way back to your starting position, just one time.
One time?
One time each. So let me get back into this. We're gonna reset.
It's supposed to be quick or slow, or does it matter?
You're supposed to just do it at your pace. The quicker, the better. It's a time test, but not in an unsafe way. So remember the time you cross the finish line. The finish line is the line of that carpet, okay? So group 1, ready, start. Got 10. All right, pretty good.
That's
Actually,
what-
11.
That is good.
Okay?
Okay.
All right, next 2.
Yeah, sure.
Ready? Go. Good, perfect. You guys all passed. That's really good. If you can't do that under 12 seconds, then your overall fall risk is dramatically increased, which is huge, right? So this is a common test we use in physical therapy. You guys can sit back down. This is a common test we use in PT to assess somebody's fall risk and that they're safe. That's really number 1, okay? Called timed up and go test. All right, good, so I feel really good about you guys, even though you didn't do so good on the foot strength. I was thinking we were gonna have some fails, but you guys all did amazing, good for you. All right, that's why walking is such a good activity. Okay, great. All right, we already tested balance. I wanted to talk a little bit about the recovery, because our name in our office is and Recovery Center. Now in medicine, you're gonna hear a lot more about recovery. I wanted to just educate you on what that means. We're really learning how to cellularly speed healing up, right? How to attack it in a different way. And so when I work with the Olympic teams, we all have this stuff. This is the American Olympic teams. When you go overseas, and I've been hired by a few other countries to work with their teams, they don't have the budget that America has for their athletes. So when we work with, when I was with the gymnastic team, we put them in red light regularly. And red light is something that is really important for health, pain, inflammation, autoimmune disease, fatigue. It's really amazing. We have this exact bed. This is the room. I go in there every morning before I start seeing patients. But not all red beds are created equal. So as a consumer, I thought I would teach you about that. There's some places that just have a panel on the wall. If you're not within 6 inches of the red lights, it's a waste of time. Don't waste your money on that, okay? Also, some beds are just red light. Red light alone is only superficial. It only helps the skin. This is why women are so interested in red light. Collagen formation, wrinkles, tightens your skin up, helps blemishes, evens your skin tone out. However, a bed like this one is different than most because it also offers infrared. You've probably heard about infrared saunas and all that. Why are people interested? Infrared waves penetrate down to the bone. Arthritis pain, deep aches, chronic pain. So those of you that have those type of conditions, you want to think of infrared as well as red light. That way you get superficial healing and deep healing. And that's why when we work with Olympians, we make sure it's also infrared. All right, so just know it's not all created equal, and look for the right thing if you go out there and purchase. Okay, the other new thing in medicine is a PEMF. Anybody hear about this yet? It's pulsed electromagnetic frequency. And what it is we've learned through medicine that we're looking at molecules and how they're behaving. You know how some of you, might be your friend, just doesn't seem to get better. They're always achy, they're always sore, everything's stiff all the time. They're systemically inflamed, okay? That's what we call it. How do we improve that? We improve it by diet, right? Because if you're eating a lot of dairy, red meat, alcohol, fried foods, it's gonna just keep you inflamed all the time, so any of your illnesses are gonna have a hard time getting better. But also something like this PMF mat, we use it as a trick to get people better because it goes in, and I guess the way to explain it in a simple way is it steals that inflammation, it collapses the inflammatory process. How does it do that? We know that inflammation is negatively charged in the body, it's a negative polarity to it. So what we basically do is go in and offer this stability to the surrounding molecules so that the inflammation just kind of can't grow, all right? So we use that with a lot with the gymnastic team, the USA track team. We put everybody on the PMF mat. We really notice their sleep improves at night. So they get a deeper REM sleep, which that hormonally, if you guys aren't getting enough sleep, that's the best thing for anti-aging you can do, is get enough sleep.
How long is a session on the mat?
Yeah, so you're on this mat for about 12 minutes. Pretty easy. And the red bed that you're on is a 15-minute treatment. You're in the red bed and you're down to your underwear and bra on that. You want the lights, you want to actually be laying on the lights so that bed closes over you, so you're kind of like in a cocoon. 15 minutes, yeah. So if you hear about recovery stuff, you'll want to know now medicine is learning about these great things that are different, right? Instead of just conventional care, we know about the new tricks for getting collapsing inflammation. Okay, all right.
So, Chris, is that targeted, or is it just like for the back only, or is it?
Oh, such a good question.
Yeah.
So this comes a few ways. You can do a whole, this is a mattress, right, treatment, and then we add a targeted area if you have one. So if you have, this really hits the back pretty good as the mattress, but if someone has a knee problem, we put paddles on the knee, or a shoulder problem for the shoulder. So what I noticed, and I was kind of poo-pooing all this stuff when I was working with the gymnastic team, because we had all this, and I'm like, I don't know. But we had so many people get remarkably better, faster than I could get them better. I had one gentleman who came in who said he hadn't slept in 20 years because of shoulder pain. One night, and he came in, he said, I can't believe I slept last night. So I started just testing the theory with all workers in the area, and it actually is wonderful. So, you know, just another option out there for you guys to start exploring and thinking about. Okay, wonderful. All right, that wraps it up for me. Do you have any questions for me or anything, comments or?
On that last therapy, are the number of sessions required individual for the patient depending
You
upon
know,
what their
I'm not-
problems are?
That's a great question. I don't really, I'm not big for this this cookie cutter numbers. I think we gotta listen to your body.
Okay.
You know, so what some people do is they're really inflaming, they come more frequently for the first couple weeks, and then they come once a month. I'm a anti-aging, probably obsessive fanatic, so for me, like, I don't wanna get a day older, so I go on the PMF mat towards the evening, I do the red light in the morning to boost my energy, I do a gajillion supplements, so for me, I really wanna prevent. So I would say for anybody, you know, just once a month at least, or once a week, depending on your pain level.
Do you do actual chiropractic work in your office?
Yes, I do. So I do chiropractor, acupuncture as well. We do all rehab, muscle activation stuff, stretching. Yeah.
Do you have a team or just you?
I work with my husband. He's in
Okay.
practice with me, together, yeah. We have a PT that's gonna be joining us this summer.
And I know it's elite sports, and you talked about the athletes and all that, and like, I'm in my mid-80s, so, for different situations there, do you deal with a lot older people also?
My favorite population actually is the patients like you, because I see the greatest change.
Okay.
You know, it's about keeping a quality of life and keeping you healthy. Yeah.
So if you need both red light and pound, or whatever, PMF,
Mhm.
you do it at different times of the day. So if
I do. A lot of my patients that come in don't have that. You know, I
Yeah,
have a
but-
PMF at my house, to be honest with
Okay.
you, so
Oh,
I
wow.
I lay on it before bed.
Yeah, my question was, so if you have
Nice.
a visit or a session,
Some people do both.
you come at different times or you do it both at the same time?
Most of the patients do it at the same time.
Okay, is it still as effective?
It's as effective, for
Okay.
influence, actually like exponentially effective, as long as you're not going for sleep. When I have people that want sleep, I tell them to come in the afternoon for PMF.
So I do have issues sleeping.
Yeah.
And because I do it sleeping.
Yeah,
I'm pickleball,
so I'd say you'd be
probably, yeah.
better, more of an afternoon patient. You know, 'cause I.
For both.
Yeah, I would say, I would think it'd be better for you.
So if you are interested in the infrared light, can you just like book appointments for
Yeah.
that?
You don't need to see any doctor for PMF or infrared. Well, PMF, we wanna see you, because there's some contraindications. You can't have metal implant in your body. We wanna make sure you have it in a newly placed stent or pacemaker. So we just have to check, make sure. Red light, you don't need to see anybody. You can come whenever you want and just, you can book an appointment online. So the QR code on your packets that you have, or your card that you have, you can just go on there and book an appointment for whenever.
So-
Now, what did you say about, like artificial joints and things?
So artificial joints, the PEMF, probably wouldn't be so great for you.
Okay.
Might be a little uncomfortable, you'd be more of a red light. But I want to give each of you a free red light session.
I don't have any, I'm just
So I
asking.
do have 3 screws in my left leg.
Oh, yeah, so then we would just
I've
knock.
had a fractured tibia with that toe.
Oh,
That's different than
Okay.
the one that other chiropractor.
So we put you on the whole mattress and probably
This is
not the paddle.
You only had one spectrum, you
Yeah.
didn't have both.
Oh,
That's
I
what
didn't, I didn't go to that
Yes.
session.
I'm
Red
gonna
light
give
is
each of you a
black.
free
Yeah.
red light for today.
Thank you.
You can book online, I think the QR code is on the back. And just enjoy it, you know, just, you know, experience it. Does anybody else want to pack it on
Oh, I have
decompression? Yeah?
Oh.
So I have another question. So I went to an ergonomics class and it mentioned the leg strength is a function of longer life, just your leg strength. You mentioned
Yeah, I can see that.
what knee, what did you mention earlier?
Balance.
Balance.
Sounds huge, which also
Something
speaks
else.
to leg strength, right?
Yeah.
Foot strength specifically.
Yeah, so he was mentioning that you could use exercise while also the lay like belly on your back, and that opens up the foramen of your spine.
So if you're going backwards, that would close the foramen.
Right.
If you were leaning forward, that would open the
Right, he
foramen.
said you do both, you ideally do both.
If you could ideally do both and you have nice flexibility in your back, I think that sounds wonderful. So usually on your back is a little unsafe for some people, so I always worry about that. But you know, more movement, the better, if you can tolerate that, for sure.
What about
This is my
inversion
card.
tables?
Pardon me?
What about inversion?
I like inversion tables. if you can tolerate it. If you have a bad back, though, some people get keyed off by that. But if you do well with an inversion table, I'm all about that.
I mean, so if
Anti-gravity.
somebody has a stenosis of the
Yeah.
lower back, I wonder if that's beneficial or.
I think it would be beneficial.
And I'm talking about with older people, I'm talking, super guys.
Yeah, for sure,
Yeah.
sure. I don't see anything wrong with that. I'm an advocate. You know, I'm an advocate for people helping themselves feel better.
Now, in your practice, your chiropractic practice, Medicare and all that pays for.
So we are a
this.
cash-based practice. Medicare doesn't cover a lot of these things. It doesn't cover PMF
no,
or
it
red
wouldn't do
light
this, yeah.
depression. For a chiropractic, we can give you a super bill that you can send it in yourself, but it's a cash practice. Yeah. Okay. Anybody else? No?
So is there like an initial,
Initial valuation?
Valuation,
Yes,
yeah.
there is an initial valuation.
Okay.
So the thing about Medicare doesn't cover initial valuations at all for
not
chiropractors.
Medicare, but if you have regular
Zero.
insurance, you have to turn it, like I'm still on a.
Yep, you'll just send that right in and they'll reimburse you.
What, you said Medicare doesn't pay for those kind of things?
They don't pay for almost all those services in the office, they just don't cover it. They don't cover for initial evaluations for chiropractors. Yeah, it's really, I don't know how, and my question is, how do you expect us to treat somebody if you don't let us evaluate a person? Like, what type of care is that? That's crap care.
You know, there's a few other things in medicine that are that way also.
Yeah, not fair, not fair for you guys, you deserve the best care,
Yeah.
you need the most complex care.
But if you have an evaluation, and then if you have other treatments and things, it's just a cash basis, is that?
Correct, so it's cash.
Do you have shockwave therapy?
Yes, I do. Shockwave, laser therapy, pretty much all the new fun tools you've heard about, we have one of each.
Okay,
Yeah.
great.
Thank you, thanks everybody for having us.
Thank you.
Very
That was excellent, Chris.
Thanks, I'm glad you liked it.